Our group, CAMS Consulting, consists of Katie Brochi, Amanda McTague, Mo Nori, and Sarah Sperling. How can the CVS acquisition of Aetna create better customer value and change the healthcare industry in order to give CVS a competitive advantage? Not all pharmacies are created equal, but one has set itself up for future success thinking outside of the box. CVS Health owns over 9,600 retail stores and over 1,100 Minute Clinics, generating $178 billion in revenue. Success has been achieved through customer-centric programs like launching loyalty programs and merging with Caremark Rx. In December 2017, CVS Health announced it would purchase Aetna for $69 billion, a strategically vertical move disrupting the healthcare industry. Aetna is the number 3 insurance payer in the United States with $63 billion in revenue and over 22 million subscribers. Success has been achieved by providing health, dental, pharmacy, disability, long-term care, and group life, mostly through corporate benefit programs. CVS contacted CAMS Consulting to lead the Integration Management Office for the acquisition to ensure the goals of both companies continue their growth trajectory. We will take you through 4 key areas of opportunity to make CVS a success now and far into the future.
The Aetna and CVS acquisition was announced to the public in December 2017 with the intent to drive a more profitable vertical integration of both companies into lower costs to consumers and even more to corporations. When the acquisition was announced, a significant majority of shareholders agreed to the deal. Through the acquisition, data integration will also help increase synergies amongst both companies and to reach a common goal of expanding the Minute Clinics and getting all Aetna members on board of the idea. Through the creation of an interactive marketing campaign, CVS can paint a picture for existing Aetna members and corporate clients on how their Minute Clinics would be more beneficial to them than hospitals. Marketing campaigns can be created on different platforms such as social media to expand awareness of their programs that may be put in place to help customers know what to expect in the near future with CVS's onboarding processes. More poster boards and mailers can be created to try and persuade members to choose CVS as their preferred pharmacy over competitors like Walgreens and Rite Aid. With regard to information, CVS would already have all members' information they need, which can help reduce wait times, eliminate additional paperwork to fill as a patient, and have a patient see a doctor quicker in order to better turnover times. When the doctor orders the prescription for the patient, picking up medicine would only be a few steps away, resulting in a significant increase in efficiencies with minimal paper trail. If corporations were to prefer Minute Clinics over hospitals, it would save them money by going to a more affordable option, save them time by going to one retail chain to answer any mundane illnesses, and pick up their prescription drugs at the same location. With so many CVS locations estimated at over 9,600 retail stores in the nation, there would be shorter wait times for all customers, which results to increase more appointments to generating more sales. The hospital systems have been overworked for far too long, and it's been reported that over 75% of ER visits can be taken care of at a low-cost care clinic. It's about time we leave the U.S. hospital systems with more acute patient care and to start to stabilize the demand for more mild illnesses elsewhere, like the Minute Clinics. These savings to Aetna would be significant. If at least half of their medical members chose a low-cost Minute Clinic over an ER visit, or if CVS used data on trying to prevent an illness to occur in the future, with an average ER visit costing over $1,233, that would total savings of over $13.5 billion. Streamlining departments within the company such as HR, finance, and IT would reduce payroll costs, as well as combining the customer service lines together so that corporate employees can increase cross-functional efficiencies to lower CVS payroll costs and gain employee retention. This acquisition can have a significant impact on the value chain, as well as with improving the back-end processes and increasing efficiency among the two companies through data integration. Both companies hold a large amount of data among their millions of members, and combining the two can lower the cost of goods sold and increase profit margins through a few ways. These ways can include using trend analysis on Aetna members by predicting when they might need prescriptions before they get ill, and which can also help reduce costs on the pharmacy end by not having to expedite a fulfillment for the drug. Also, the big three components of the healthcare supply chain are now under CVS, and the pharmacy benefit managers can now lever that information and work in favor of the healthcare provider and against the big pharmaceutical companies by not using the previous business strategies and secrets to reach maximum monetization of the prescription drug.
Effects are present, the value of a product or service increases as the number of users grow. A network effect is needed to enable CVS to derive direct benefits from creating exchange, staying power, and complementary benefits. A strategic initiative that is recommended for CVS to gain a competitive advantage is to expand its MinuteClinic presence into existing CVS locations to 25%. CVS would need to remove unprofitable retail categories to repurpose space to add MinuteClinics to existing CVS locations. The exchange opportunity of the more customers utilizing the MinuteClinics, whether Aetna members or members of other insurers that are satisfied with the service received, the more likely customers will think to go to a CVS MinuteClinic before going to the emergency room based on the severity. The staying power associated with this initiative is MinuteClinics will have access to Aetna members' medical information, creating more awareness of patients' overall health when being seen by a nurse, as well as billing information in the customer's profile that may not be easily transferable or accessible in another clinic or emergency room. The complementary benefits is customers will also be able to pick up prescriptions where they are getting diagnosed, a true one-stop shop. Another strategic initiative that is recommended to create an additional network effect would be enhancing the features of the current CVS mobile app. CVS has the accessibility to increase the usage of medication reminders on its app by offering an incentive such as extra care loyalty points or premium adjustments the following year to Aetna members, leading to a decrease in avoidable healthcare costs for Aetna. An added feature would be on-demand doctors, allowing patients to access doctors 24/7 to advise on healthcare needs. The exchange benefit with on-demand doctors is the more customers utilizing this feature, the bigger the network of accessible doctors becomes. The staying power associated with the updated centralized app is all the customers' information that pertains to CVS, such as prescriptions, loyalty points, and medication reminders, is stored in one place. The complementary benefit is the extra loyalty points or premium adjustment that can be earned the following year for Aetna members by utilizing the medication reminder platform. With these strategic recommendations, CVS acquisition of Aetna would enable the opportunity to create a competitive advantage through network effects that otherwise would be unmatched in the current industry market.
As you just heard, there are many great benefits to data integration, but how can you drive business growth and customer retention? CVS currently has access, while separate, to over 22 million customers' data through their CVS Health app, POS data, pharmacy data, and insurance data. Combining these key data sources will allow CVS to make more informed decisions that range from pricing of medical services, prescriptions, over-the-counter medications, and insurance, to building out predictive capabilities to intercept customers before they fall ill. By creating a digital ecosystem, CVS will enable itself and its partners to build out a platform that allows customers to feel in control and in charge of not only their healthcare choices, but empower them to impact the cost. Integrating current data sets with new ones will be key to expanding beyond what we already know. Access to health apps and trackers, purchase history at other retailers like Amazon, Walgreens, Walmart, weather, CDC, and other health organizations' reporting and statistics, and survey data will expand knowledge and inputs to these key decisions that need to be made. Ultimately, this will create a deeper customer relationship that will continue to allow for member and shopper growth. Today, both companies collect a large amount of data on each of their customers. In order to drive greater adoption, CVS should also integrate the CVS app to include all of the Aetna services from finding and purchasing health insurance to estimating costs to locating doctors, including Minute Clinics and CVS virtual doctor locations, in-network in the area. By creating this aggregation of key data sets, the company will be able to create clusters of key customer segments across multiple categories. Working with a market research company, we recommend that the segments that are created fall into tiers, ensuring both purchase, health, and insurance level data are taken into consideration to create these segments. Once these segments are created, personalization becomes possible. Targeted marketing and offers can generate immediate incremental impact on sales and customer engagement. CVS can guide customers on their journey based on these key connections from insurance buying, choosing a provider, Minute Clinic or virtual doctor, to purchasing over-the-counter and pharmaceuticals, ultimately creating a one-stop shop for all customer needs both digitally and in store. Additionally, this data will inform the right moment of truth, or even better, the 0 moments of truth. By bringing the customer to the center of the equation based on knowing who, what, when, and why a customer is behaving, will provide the right moment to intercept, whether it is before they know they need a product or service or while they are on the decision-making journey. CVS can use this information to better predict when an area is becoming ill and notify the customers to stock up on certain products, whether it be sponsored by a brand like Zicam or Kleenex, or generic suggestions of coming in to stock up on hand sanitizer.
We will now be reviewing how CVS can use disruption and technology to its advantage to seizing the pharmaceutical industry. Traditionally, the healthcare industry is risk averse, with little change over the past several decades. However, this does not indicate that consumers are happy with the industry's current state. In fact, a survey by Medical Marketing and Media reports that 81% of consumers were unhappy with their last healthcare experience. Issues with healthcare, coupled with the fact that costs have been dramatically increasing, creates a disruption opportunity for CVS. There are 3 necessary components for digital disruption: a changed commercial ecosystem, a new business model, and technological enablers. As stated, the ecosystem has changed. Consumers are unhappy and the costs are rising. Additionally, consumers have become increasingly comfortable with digital options. As discussed previously, we suggest that CVS expand upon the Minute Clinics and use the integrated data sets to drive cost savings and healthcare advancements. The cost savings with Aetna from less ER visits and data integration can be used to reinvest in Minute Clinics and technology. Finally, the updated mobile app and platforms network effects associated with the doctors on demand will help disrupt the industry. Looking at the disruption graph on the right, you can see that the existing improvements to the healthcare market are below consumer expectations. When CVS begins a Minute Clinic venture, the costs will be lower, as well as performance and variety of services. The low cost and physical convenience of the store and pharmacy locations will initially draw consumers in. As previously said, approximately 70% of the population lives within 3 miles of CVS. However, as the Minute Clinic expands, more services will be provided. Additionally, CVS can use the data integration to its advantage and potentially improve on chronic illnesses such as diabetes. There have been past issues helping patients with chronic illnesses due to HIPAA regulations and patients transferring frequently between doctors, pharmacies, insurance agencies, etc. However, if consumers use Minute Clinics as a consulting hub due to the convenience and phone reminders through the app, this could encourage preventative health care. Minute Clinics can provide nutritional guidance, and on the insurance and data end, Aetna can see if consumers are truly taking their medications and see at a macro level what behaviors are driving results. Data analysis can be used for preventative measures for future patients and improve results over time. Disruption, CVS should also focus on brand management and truly build one that consumers can trust, which is a rare concept within the healthcare industry today. Instead of just being a retail store or a faceless insurance agent, CVS should be looked at as a one-stop shop where consumers can easily have health, pharmacy, or insurance questions answered. Within the store, they can answer simple questions and provide pricing clarity on healthcare for consumers. A simple frustration for consumers is having a simple procedure or appointment without upfront
pricing and getting surprised with a large bill weeks later. In addition to the storefront, as previously discussed, CVS will drive better patient care through the platform, data integration, AI, and improved research. The brand is the key that will keep large competitors such as Walgreens and Amazon. Though Amazon just reported they will not be entering the pharmaceutical industry, who knows what will happen in the future. The technology enablement will certainly disrupt the traditional doctor's offices, as they will not have the capital or resources to invest to compete with CVS products. Finally, the ER will also be disrupted with less customers. However, it is likely to have a benefit to the industry. Hospitals can spend less resources on the cases that don't need to go to the ER and focus on those who are more in need. We believe that the data integration will drive down some costs in a market that has suffered from pricing increases for decades. Through the network effects, more consumers will be drawn to CVS, and as the network grows and more patients go to the Minute clinics, CVS will be able to increase the network of doctors and RNs for the Doctor on Demand network. Additionally, the digital ecosystem of CVS will improve healthcare, which will improve the overall experience for both the consumers and the service providers. All of these changes will truly disrupt and change the healthcare industry. The question for the future is how the competitors will respond.